Hello, everyone, and welcome to the LEAD Center's webinar on customizing employment success through partnerships. I'm Rebecca Salon, Project Director of LEAD Center. Before we get started, we wanted to go over a few logistics. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel pictured below. If you accidentally close the panel, you can reopen it by going to the Communicate menu at the top of the screen and choosing Join Audio Broadcast. If you don't have sound capabilities on your computer or prefer to listen by phone, please dial 1-415-655-0001 or toll free at 1-855-749-4750. The meeting code is 407-197-903, and there is no attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize the other panels like Chat, Q&A, and/or Participants. We will have time at the end for questions, so please use the question and answer box to submit any questions you have during the webinar, and we'll direct the questions accordingly during the Q&A portion of the webinar. If you're listening by phone and not logged into the webinar, you may also ask questions by emailing btaylor, that's B-T-A-Y-L-O-R, at ndi-inc.org. Please note that the webinar is being recorded and the materials will be placed on the LEAD Center website at the link provided, or you can go to the website and click the webinars button in the top left corner, and you'll have a list of all of our webinars. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host, Brittany Taylor, or you may also email her at btaylor@ndi-inc.org. For those of you who aren't familiar with the LEAD Center, we are the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities. We're a collaborative of disability, workforce, and economic empowerment organizations led by National Disability Institute with funding from the U.S. Department of Labor's Office of Disability Employment Policy. Our mission is to advance sustainable individual and systems-level change that results in improved, competitive, integrated employment and economic self-sufficiency outcomes for individuals across the spectrum of disabilities. So in today's webinar, we're going to be covering a number of important topics. We're going to start by talking about the importance of customized employment for people with disabilities who access the workforce system through the Workforce Innovation and Opportunity Act and as a universal design. The Workforce Innovation and Opportunity Act for the first time included a definition of customized employment in Title IV, where it defines customized employment as competitive, integrated employment based on individual determination of strengths, needs, and interests of an individual with a significant disability that's designed to meet specific needs of the individual and the employer and carried out through flexible strategies. So we'll be talking a lot about that today. The session will also talk about integrated resource teams and the braiding and leveraging of resources for customized employment through American Job Centers, lessons from the field, and we'll talk about partnering for customized employment delivery, where we'll offer examples of interagency collaboration that resulted in successful employment outcomes and provide an employer's perspective on the value of customized employment. And as I mentioned, we'll have some time at the end for questions. The objectives are that we will identify opportunities for collaborations that enable youth and adults with disabilities and others who experience barriers to employment to benefit from customized employment strategies to achieve employment outcomes. You'll learn about practices that are being successfully implemented in different parts of the country, and learn about customized employment resources that can be used to assist job seekers in getting and keeping jobs. So I will be moderating today's session along with Gary Shaheen. Gary is the Director of Policy and Programs at Social Dynamics. Our speakers today are Brian Ingram and Lisa Mills. Brian Ingram is the Technical Assistance Liaison for National Disability Institute. Brian is a nationally recognized subject matter expert on integrated resource teams and on working with partners in and outside of the workforce system to assist individual job seekers with multiple challenges to employment to achieve their employment goals. Lisa Mills is currently a consultant and nationally recognized expert on disability employment policy and systems change, working in multiple states through the U.S. Department of Labor's Office of Disability Employment Policy and its Employment First State Leadership Mentoring Program, and through the LEAD Center, in addition to other national and state initiatives. So, go to the next slide. So the LEAD Center has been piloting two approaches to customized employment, both designed to be implemented in partnership with the workforce system, and you'll be hearing about both of them today. As many of you know, the cornerstone of customized employment is a process commonly referred to as discovery. In collaboration with a number of workforce and community partners and a number of subject matter experts, LEAD has been piloting both guided group discovery and self-guided discovery, both of which were implemented in partnership with staff at American Job Centers, also known as one-stop career centers, and in partnership with others that support workforce development, including partners from vocational rehabilitation, developmental disabilities, behavioral health, centers for independent living, homelessness services, community colleges, and more. So LEAD Center will be releasing the Guided Group Discovery Facilitators Guide and Participant Guide in December, and will release the Self-Guided Discovery Facilitators Guide shortly thereafter. If you're on our mailing list, which you can sign up for at leadcenter.org, you'll be notified as soon as these manuals are released. I also want to encourage you to visit LEAD Center's redesigned website, just relaunched late yesterday, which has an entire customized employment section, as well as sections on WIOA and workforce development, financial literacy and capability, and cross-system collaboration. The website also has advanced search functions, making it easier to locate resources, and our site still links to the Comprehensive Employment First site and all of its resources, where you can learn about what's happening in your state to support employment for people with disabilities. Since the site's new, please let us know if you encounter any issues while using the site via the email or the Contact Us link on the site. We encourage you to visit our site whenever you're looking for resources on employment and economic advancement for people with disabilities. So we're now ready to move into the content. I want to turn this over to Chris Button and Gary Shaheen, and first Chris to provide some background for the webinar. Chris?
Thanks, Rebecca, and thank you, everyone, for joining us today. We're really especially excited about this particular webinar. ODAP began working on the notion, the idea, the concept of customizing employment back in 2001 with a series of different grant initiatives tied to the public workforce system, under the assumption that really some of the best features that we have learned about disability and employment were universal design strategies that could assist many people with barriers to employment in becoming successfully employed in competitive integrated employment. And that is obviously very relevant for people with disabilities, but it's also relevant for people who have other barriers, such as perhaps they are in TANF. Many people on TANF, as we know, do have disabilities. But maybe people have limited English proficiency. Maybe people have issues with homelessness or transportation or any other challenges in their life that makes kind of following a traditional job path more challenging for them. And so we tested through our customized initiatives the idea of of having the generic system, the public workforce system, be a locus for braiding resources across multiple different systems to be able to get people a more customized outcome. And that became a major activity, as Rebecca said, that LEAD has been working on for us over the last few years. And we are really excited and pleased with some of the results that we are finding. There are ways to make customization available through the public workforce system as well as through partners of the system. And through braiding the activities of those systems, through becoming an employment network for ticket-eligible people and gaining access to services that way, there's a plethora of ways that we can make this available to job seekers, both with disabilities and with other barriers. Today, we're, of course, focusing on people with disabilities, but the manual and the materials that Rebecca was talking about are relevant to people with barriers to employment across the board. So, again, we're really excited to share what LEAD has been doing and what these amazing speakers today have been taking part in, as they have helped to really blaze the trail in this area across the country. So I'm excited to hear what they have to say, and Rebecca, I'm going to turn it back over to you.
No, thank you so much, Chris. And I'd now like to invite Gary Shaheen, Director of Policy and Programs at Social Dynamics, to give some background information on some of his customized employment work. Gary?
Very good. Yep. Thanks, Rebecca. Hello, everybody. This webinar is the first of many customized employment training resources that Social Dynamics produced over the past year for ODEP and in partnership with LEAD. And the materials are specifically targeted towards American Job Center staff and the staff of ODEP's Disability Employment Initiative, and they're produced with the assistance of some of the nation's leading CE subject matter experts, including Lisa Mills, who is presenting today. And there are many more good things to come that will help promote and embed CE throughout the public workforce system and among its partners, as Chris mentioned, WIOA intends. So we're really excited to have been a part of this, love working with LEAD and our friends at ODEP. And with that, I'm going to turn the mic back over to Rebecca and to introduce our panelists. Thank you so much.
Thank you, Gary. So with no further ado, I'd like to reintroduce Brian Ingram, Technical Assistance Liaison from National Disability Institute, to talk about braiding and leveraging resources for customized employment through American Job Centers. Brian?
Well, thank you, Rebecca, and thanks to all of you for attending this presentation on customizing employment success through partnerships. Now, my name is Brian Ingram, and I work for the National Disability Institute, which provides technical assistance through a DOL contract to the Disability Employment Initiative projects across the country. Now, in my DEI role, I act as a subject matter expert to the projects for both customized employment generally and the Integrated Resource Team specifically. And the Integrated Resource Team is what I've been asked to speak to you about today. So, what is an IRT? An IRT is an informal, customer-level strategy for providing resource coordination to a customer with disabilities and/or multiple challenges to employment. It's a strategy that originated in customized employment, but it has been forged, so to speak, in the Title I service delivery system during the Disability Program Navigator Initiative originally as a best practice, and then in a more systematic way as a service delivery component under the Disability Employment Initiative. The process is divided into two parts: active resource coordination and integrated resource team facilitation, which line up generally with Title I core and intensive services. Now, we'll talk a little bit more about that later, but right now, I think we ought to start by talking about the employment goal, because an IRT cannot exist without a clearly identified specific employment goal. Can we advance the slide? Thank you. Now, the reason for this is that an IRT is all about the employment goal. That goal is the reason for its existence and the only reason that it makes sense to go to all the trouble to create one with a customer. This means that IRT activities must be connected to some sort of career exploration or discovery process, and that this process needs to be accessible to customers who experience disability and multiple challenges to employment. Most job centers are going to have some sort of support in place around career exploration, but that doesn't mean that this process needs or should be limited to what's available in the job center. In fact, a little later in the presentation, you're going to hear about a center in Kansas that's benefited from a DEI project partnering with a mental health provider to provide a group-guided discovery process that led to the development of employment goals that were later supported with IRTs. In the DEI, we found that career exploration strategies that use a strength-based, customer-centered approach are much more accessible to customers who have limited or non-traditional education and work histories. And these types of approaches implemented in the Title I service flow directly or through a partnership and collaboration approach can greatly increase access for customers with disability and multiple challenges to employment to Title I services, and most importantly, the outcomes associated with those services. Now, let's move from career exploration and start talking about the IRT itself. And oddly enough, I want to start talking about the IRT by talking about what an IRT is not. So if you can advance the slide. So these are some of the things that an IRT is not. Now, as we were talking about on the last slide, an IRT is built around an individual customer, their individual employment goal, and what that customer needs to obtain that goal. Another way of looking at this is that an IRT is an informal, customer-level team composed of a number of providers that have coordinated their services to attain a shared employment goal. Each provider is still going to have their own individual service plan and will need to obtain the outcomes associated with their services. So this is different from collaborations that are the result of a systems-level agreement, in which a cohort of customers share a set menu of resources or work to obtain the same employment goal. An IRT is infinitely flexible, and its membership is usually different for each customer served. The members of the team are determined by the resources each customer needs to reach their individual goal. This is important for customers who experience multiple challenges to employment because each service provider tends to focus on addressing targeted issues. For example, Title I services are resourced to address training and placement, right? Issues falling outside of these parameters are often impossible for a Title I provider to address directly and have the potential of keeping a customer from benefiting from the services that Title I can provide. Customers with multiple challenges to employment need to have their challenges addressed simultaneously in order to be successful. The IRT is a strategy that allows for this level of coordination around these customers. All right, so which providers can participate in an IRT? Absolutely any that are needed. For example, the workforce investment system, of course, mental health, vocational rehabilitation, independent living centers, programs for deaf and hard of hearing, the Commission for the Blind, community work incentives coordinators, CWICs, supported employment specialists, housing providers, TANF staff, and even advocates or friends of the job seekers. I think you get the gist, right? The IRT is composed of whatever providers a customer might need to address the challenges to employment associated with the attainment of their employment goal. It can literally include anyone or anything that makes sense in this context. So think of this place as a place to start, and then you'll be on the right track. So now that we know what an IRT is and who can participate in it, let's get on to the main course of how the strategy is implemented. And I'd like to start by taking a look at a flow chart that outlines IRT implementation. So this is a little visual I put together that illustrates a few things. The arrows on the left indicate a kind of basic vocational case management flow, right? Planning, implementation, and retention. The bullets list specific activities from the IRT strategy that correspond to the flow on the left. And to the right is listed where in the Title I flow these activities occur, core or intensive. Now, I'm showing you all this at the beginning because I'm kind of a big picture kind of guy. And specifics always make more sense to me if I understand the larger context. But have no fear, we're going to be covering all of the bullets in more detail as we move forward. For now, I just want you to notice how career exploration leads into active resource coordination, which leads to the formation of the IRT, which coordinates multiple service plans and then stays active through retention. So try to keep this in mind as we cover active resource coordination. You can advance the slide. Now, a question I'm often asked is, how does the job seeker get connected to all these resources? And how is the participation of these providers guaranteed without the support of standardized procedures, an MOU, or an interagency agreement? And it's a question that leads us into a discussion of the first of the two parts of IRT facilitation, active resource coordination. So active resource coordination is the process of identifying needed resources and appropriate and prioritized action steps to address specific targeted barriers to employment experienced by an individual entering the job center's customer flow. Active resource coordination always takes place prior to an integrated resource team being put into place, although active resource coordination may take place without resulting in an IRT. So active resource coordination is not the same thing as referral. In a referral process, challenges that a customer experiences are identified generally, often before an employment goal has been determined or Title I services are considered at all. In active resource coordination, a customer is engaged with the Title I system as the employment goal is determined. And then providers are approached, including Title I, based on the resources needed to attain that goal. Another important distinction between referral and active resource coordination is that under active resource coordination, the customer is supported as they connect with additional resources. Staff place referrals into the larger context of attaining an employment goal. They walk through the procedures associated with accessing the services they are referring to. They assist the customer to prepare for the referral by collecting needed documentation and releases, and they're available to advocate for the customer as they go through the eligibility and enrollment process associated with the providers that they've been referred to. Okay, you can advance the slide. So active resource coordination is actively assisting the customer to identify, explore, and access available resources in a way that's specific to assisting that customer achieve their employment goal. It's positioning the customer in the Title I system prior to coordinating with other providers. It's providing customers with targeted support around coordinating their resources that goes beyond simple referral. Finally, it's acknowledging that a customer often has the least amount of leverage when it comes to advocating for themselves within service delivery systems. So I think that last point needs a little emphasis. Back in the day, I'm not going to tell you how long ago, I was a WIA case manager. And when I was working with job seekers who had a lot of resource needs, I would make referrals. Sometimes I'd make many referrals. And I can testify to the fact that the systems I referred these customers to were complex, arbitrary, and not very good at communicating with the participants. I learned that the more referrals I made for a person, the less likely I was to see them again, as they would inevitably get swallowed up into the processes and procedures of the providers I had referred them to. This is a giant hole that customers most in need of Title I services often fall into. Active resource coordination acknowledges this and attempts to provide targeted support throughout this whole resource acquisition process. Okay, next slide. So just to be very clear, active resource coordination begins with an employment goal, then makes referrals based on needs specific to attaining that goal. In active resource coordination, referrals are made internally to WIOA Title I services before or at the same time referrals are made to other systems. In active resource coordination, the WIOA Title I system makes an initial commitment to advocate for a customer as they engage in eligibility for additional services. In active resource coordination, the WIOA Title I system makes an initial commitment to take the lead in convening multiple service providers for the purpose of resource coordination. All right, so now that we've metaphorically gathered all of our partners together using active resource coordination, let's talk about the integrated resource team itself. Go ahead and advance that slide. Thanks. And we're going to start our discussion of the IRT with the IRT meeting. The IRT meeting is when the job seeker, with the help of center staff, contacts all of the relevant providers, and by this I mean relevant to the customer reaching their employment goal, right, to reach consensus around 3 key parameters. And these parameters are, number 1, a common employment goal, number 2, a sequence of services, and number 3, lines of communication. It's in the reaching of consensus that the team is created. And it's the team that's the IRT, not the meeting. This distinction is important to grasp in a couple of ways. First of all, because the IRT is informal, and it takes place at a customer level. This means the IRT does not set up a super employment plan that all of the providers must then follow. Because it's an informal strategy, each provider still has their own plan, and they continue to do their business and their reporting in the ways that they're accustomed to. It's just that once consensus has been reached, all of the provider plans line up on those 3 key parameters, and because of this, all of the services are coordinated. Secondly, the meeting itself is not the IRT, the consensus is. I think when the strategy was first presented to the field, a lot of emphasis was put on having a really big meeting where all the providers and the job seeker got together to discuss and reach consensus. So much emphasis was put on the meeting that it became a common misunderstanding that the meeting was the point of the strategy, not the consensus. But let me put this plainly. Reaching consensus around those 3 key parameters makes the team, whether you do it in person, by phone, or by email. The meeting is a very effective way to do this, but it's not the only way. Now let me finish by saying this. The team is going to stay in place as long as it's needed, and its members are going to continue to participate for as long as the customer continues to receive services from them. Each provider operates on a different timeline, and because of this, the membership of the IRT may shift and evolve over time. This is fine. It's more than fine, actually. It's kind of one of the strengths of the strategy. Different partners come in and out, and that IRT is dynamic based on the needs of the customer at the point they are in getting their job. Okay, you can advance. Okay, finally, I'd like you to take a look at this visual that attempts to show how the IRT strategy can be used in conjunction with the discovery process to seamlessly move someone into a fully resourced strategy for employment. Listed are some discovery activities that can help someone to develop a strength-based self-determined employment goal, which, as I mentioned earlier, is ideal for organizing the IRT around. So stuff like engagement conversations about work as a possibility, supporting employment goal development through evidence-based methods that might include harm reduction, motivational interviewing, informational visits, job testing. Discovery 101, which is an informal place-based conversation about strengths, assets, skills, and using that as a basis for forming an employment goal. And arraying needed services around the individual to support employment, housing, food, supports, etc. Now, based on what we've been discussing, I hope it's becoming clear how such a process could very easily move into active resource coordination, and from there, of course, into an integrated resource team. So I would like to leave you thinking about the possibilities, because I really think they are amazing and that there's a lot of potential in this model. So I will leave you with that. Thank you very much for your time, and I hand it back to Rebecca.
Oh, thanks so much, Brian. That was just great. We are getting a number of questions in the question and answer pod. We're going to hold them until the end. Brian, you may want to look at some of them because some of them definitely are addressed to you. But we'll wait until the end to address those questions. And with that, we'd like to turn it over to Lisa Mills, who's the owner of Moving to a Different Drum, to talk about partnering to implement customized employment strategies. Lisa?
Thank you, Rebecca, and hello, everybody. I'm going to talk through some real-life examples of AJCs working with community partners, implementing different aspects of customized employment to enable individuals with disabilities to obtain employment. Brian made an important point in his presentation that an IRT cannot exist without a clearly identified employment goal. And we're going to focus today on using strategies from customized employment that can really help with doing that very important piece of identifying the employment goal. But in general, as you are completely aware, the AJCs are used to and experienced with working with community and state system partners. It's an essential strategy for the success of the workforce system, and it fits really well with the use of customized employment as an evidence-based employment strategy for people with disabilities. We have recognized over the course of the 15 years Chris Button talked about in implementing customized employment that this approach requires coordination of resources across systems. And we believe that there are unique ways that AJCs can partner with community providers of disability services to be able to implement customized employment strategies to create that kind of coordination of resources across systems and to enable positive employment outcomes. Some of the advantages of partnering with other disability service providers for AJCs is that they are able to reach job seekers with disabilities that they might not otherwise have been able to reach. Job seekers who may not necessarily find their way to an AJC or be able to access AJC resources online or in other ways. I think it also provides an opportunity to really effectively serve job seekers with disabilities. So AJCs entering into partnerships to coordinate supports with another disability service provider can really help an AJC effectively serve a job seeker with a disability, and that includes those with the most significant disabilities, which WIOA puts a strong emphasis on. As well, if that partnership between the AJC and the disability service provider begins early, as in some of the examples I'm going to share, there's a much better chance then of coordination of services and resources across systems for an individual that is typically necessary for them to reach their employment goals. And we have found that this type of partnership can actually enable an AJC to implement customized employment strategies, whereas they may have presumed in the past that there was only certain ways that customized employment could be implemented, and it might have seemed like it was a better fit with the vocational rehabilitation system. Some of the things that the LEAD Center has been piloting, I think, really suggest that there are good opportunities for AJCs to use customized employment as well. I'm going to first start by talking about guided group discovery, which is a LEAD Center innovation. We've been working on this the past few years in a number of states, piloting a process. It essentially uses that core discovery component of customized employment. I think most people would agree that discovery is the most widely embraced aspect of customized employment at this time. And essentially what guided group discovery does is offer it in a small group facilitated model that opens up some opportunities. So what we've been piloting is AJCs partnering with a disability service provider in their area who is serving working age individuals who do not yet have competitive integrated employment. And the model actually involves the AJC hosting the guided group discovery at the AJC. So it in some ways mirrors kind of other workshops that an AJC would typically offer. In our pilot, we essentially use an AJC staff person and then a staff person from the disability service provider work together to co-facilitate the guided group discovery process. It occurs over a number of weeks within meetings, typically once a week of the group that is participating. It's a really nice model for those who would benefit from peer support and peer interactions in their process of determining their employment and career path. The involvement of the disability service provider really makes it possible to offer the supports that people need to participate. Those would be supports potentially if they needed assistance getting to and from the AJC. Could also be supports offered during the actual guided group discovery sessions or in between those sessions when people are working on their homework assignments as they move through the process. The resources of the AJC and all of its partners also then become available to the individuals, and it is a natural progression from going through the process of guided group discovery and arriving at an employment goal to then being able to access the resources of the AJC, and as Brian emphasized, to get to the point of using an integrated resource team to ensure people can reach their employment goal. We are going to talk about success stories and examples, and my first example is from Butler County, Kansas, where the AJC partnered with a community mental health center. A member of the staff from the AJC and the mental health center co-facilitated the process, and as a result, the AJC got connected with individuals who have psychiatric disabilities who wanted to obtain employment. And we have one of the co-facilitators of Guided Group Discovery from Butler County, Michaela on the webinar with us today. And I'm now going to share one of the success stories that came out of that. An individual named Laura who participated in the Guided Group Discovery after being connected by the Community Mental Health Center. As she went through the process, it helped her clarify that she had a desire for a career in child development. Initially, to get her started on the path towards that career, the AJC and the Mental Health Center coordinated efforts to help her find an initial job. She was working 40 hours a week, earning $10 an hour at a call center. Now, that is not obviously a career in child development, but it was a great way for her to get started. In order to help her do that, the AJC also made supportive services funds available to her so that she could get to and from work for the first 6 weeks on the job until she could assume the responsibility for that long term. In addition, to make sure they stayed focused on her career goal, the AJC was able to make training funds available to her so that she could return to community college and obtain certification in early childhood development. They do recognize that this is an entry-level certification, but it begins to put her on the career path that she chose as a result of going through the guided group discovery process. And the other really important piece of this is that because the guided group discovery was a partnership between the AJC and the Mental Health Center, both entities were making sure that Laura's needs were met during the process. and then after. So instead of just focusing on career employment needs, they could make sure that her psychological, physical, and financial needs were also being met, so that they had the best possible chance of success with her pursuing her employment goal. Michaela, I would like to ask you a question now since you're on the call. If you could share from your experience why you believe guided group discovery is a good first step for a job seeker with a disability to take?
Yeah, so for the groups that we've worked with, a lot of the folks that come to us, they want to work, but they either haven't worked in so long that they don't know what they, really would be well suited to do. They don't really have a goal in mind necessarily when they come to us, or the goal they have is so far down the line that they can't figure out how to put the steps in place to help reach that goal. So that's been probably the most useful piece of the guided discovery process for us, was in helping us help them focus and figure out what that goal was and how we can realistically get to that goal. Thank you for sharing that. I do think that one of the reasons discovery as a component of customized employment has taken root so strongly across the country is that it does just that. It really helps people who may want to work but not have a sense of what the right employment is for them, what the right career track is for them, and what they have to offer employers in their area, can get to that in a thoughtful way through the opportunity to use discovery. I'm going to move on to a second example of guided group discovery that involved a partnership between Workforce Essentials, the AJC in Clarksville, Tennessee, and an organization called Progressive Directions, which is a Medicaid intellectual disability service provider in Tennessee. The AJC and Progressive Directions teamed up to co-facilitate guided group discovery at the AJC, which is really important because it brought individuals with intellectual disabilities who probably never would have set foot in an AJC, a great opportunity to come into the AJC and participate in guided group discovery and see for themselves what AJCs had to offer for them. The Progressive Directions, the Medicaid service provider, because they were already linked up with the individuals, were able to use that funding stream to provide transportation so that the individuals could come to the AJC, and also to support the individuals with support staff as they participated in the guided group discovery. So they had supports both to get there and during the time they were participating in the sessions. The success story here was that every individual from Progressive Directions who participated in the guided group discovery at Workforce Essentials was offered a job at competitive wage. And it really, in reflecting on the experience, I think both Sharon and Margaret would say that it helped the individuals really expand their view about what types of jobs they were qualified for and what types of employers they could make positive contributions to. And as I mentioned, that by hosting this at the AJC, the individuals and the Medicaid provider were able to become familiar with the AJC and the many resources that it can offer. As a profile of one of the success stories, we had an individual who got a job at a local hospital. And typical of many individuals who obtain customized employment, they will, as they get comfortable in their role and demonstrate their abilities to the employer, he chose to advocate for new and additional tasks to be added to his customized job description. So as a result of being able to show his supervisor what he could contribute to the hospital, and seeing where the hospital might benefit from him contributing and taking on different duties. He received a raise last month, And we are fortunate to have both Sharon Hancock from Workforce Essentials, the AJC, and Margaret Davis from Progressive Employment on the line. And I'd like to just put a question to Sharon initially. From your point of view as a staff person at an AJC, having been through this pilot, how feasible is it, would you say, to replicate this with other Medicaid long-term support providers who may serve people with significant disabilities? And I hope we're going to have Sharon on the line.
I was muted. Hello? I was muted. Okay, so what I was saying was that I think it was a really wonderful experience to have all of the people that were coming in with PDI, Progressive Directions. We learned a lot because in the forum that we were holding the group discovery session, you know, it allows people to talk to each other. So, you know, people would ask questions, you know, regarding maybe Social Security work incentives or other things like that. Things would come out where we would actually be able to solve a lot of those issues that maybe not would have happened had we not had that kind of a forum. By having them here, we, you know, whenever something was going on, if we had any kind of job fairs or anything, I'd always bring the flyers out, you know, give them to all the folks that were attending, and so they knew that there were, you know, different jobs available to them that they could look at. We talked about different careers. It opened up so much to allow them to learn about how they can disclose and if they should disclose or shouldn't disclose if they have a disability. And I just think it's very much a great program, a great partnership, because, you know, in the American Job Center system, we do what we do best. And then with the Medicaid long-term support services providers, they do what they do best. And so we can really, you know, work together in a wonderful partnership to have a great outcome, which is getting people jobs and having them become employed.
Great, thank you, Sharon. Mm-hmm. And if Margaret's on the line, I would just like, from her perspective, to talk about how guided group discovery hosted at an AJC helped make the AJC's programs accessible to the people with intellectual disabilities that her agency supports. Margaret?
Yes, ma'am. Thank you. For the group that we had going to the guided group discovery, all of them were pretty new to out of high school, so they were still learning about their community. And they would see this big, beautiful building that we call the AJC, and they would think, well, I'm not sure if that's for me or not. And being able to have the guided group discovery there at the AJC opened up their views of what resources they had in the community, because at Progressive Directions, we don't just do it for them, we teach them how to do it. That way they can learn the process of learning about a job, finding a job, and getting it on their own, so they can have that knowledge from here on out. And it was a wonderful experience, and I hope we get to do it again.
Great, thank you. Yeah, I think you made the point about enabling people to take charge of their own employment path and helping them understand and assisting them to actually make use of the AJC is a really important role that a Medicaid provider can play. I'd like to move on now to talk about self-guided discovery, which is another innovation created by Griffin Hammes and Associates that the LEAD Center is supporting and can be implemented in an AJC. Again, this takes customized employment with a strong emphasis on discovery and makes it into a self-guided, self-paced process. And this serves yet another purpose and is yet another model for how discovery can be implemented. So we know that one-to-one individualized facilitated discovery exists. I just talked with you about small group guided discovery. And this model actually allows an individual who may not need or may not want those other forms of discovery to still take advantage of what discovery has to offer. There are many people who can benefit from self-guided discovery. And some of them are listed on the slide here. Job seekers who have a disability but who may not qualify for services from other systems that provide employment services like vocational rehabilitation. It could be for people who had a previous career but who have recently acquired a disability. Maybe that returning to that career is not an option, and so they really are needing to start again and determine what the right career and employment goal is for them. Also, people with a disability who may have a college degree, a technical certificate, or some kind of advanced training, who are trying to figure out where they fit best in the local employment market and which employers would they have the most to offer to. Veterans with disabilities who may have been trained in specific skills in the military but are now faced with making that transition back to employment and career may benefit from this process to help guide their employment plan and effort. People with sensory disabilities, people with Asperger's. There's really a broad range of people. I would count myself among this list because, frankly, anyone who's considering either because they want to or they need to make a significant career change, Discovery is a good tool, and it can assist people from all walks of life in terms of helping refine an understanding of what career and employment goal makes sense. The effort the LEAD Center has been making with Griffin Hammes also involves making self-guided discovery a tool available to families of children and youth with disabilities, again, trying to empower those families and those youth to find a path to employment and to determine the next steps that they need to take to reach an employment goal. It's encouraged that this families start early in thinking about employment. There's very, very strong emphasis in WIOA on youth with disabilities transitioning to competitive integrated employment, and really giving resources to families and assisting them can really help increase the likelihood that youth will make that successful transition. The self-guided discovery process can be used over a number of years. It can also help guide transition services for youth with disabilities who may be receiving special education services, so that once a post-secondary employment goal is determined, what is needed in terms of transition services to reach that goal can be informed by the self-guided discovery process. And it can also guide investments that may be made by an AJC or vocational rehabilitation or schools and Medicaid around work experiences, supporting academics, skills training, supporting youth to have after-school employment or summer employment, and any efforts around school-to-work transition. The more individuals with disabilities understand themselves and what they need to be successful with employment and where their strong aptitudes are for employment, the better our resources will be applied in terms of helping them be successful. And Discovery really helps with gaining a really comprehensive understanding of who people are. Some of the components in the self-guided discovery process are listed on this slide. Again, it's comprehensive. There's a personal profile. It discusses financial goals. It works through exploitable, marketable skills. It looks at a very important piece around ideal conditions for employment. It involves touch base with professionals who support people through the process. although it is much more self-guided and individual directed, there's still a role for providing support, which I'll talk about in a little bit more detail. It helps define vocational themes to guide the outreach to employers, and it can help link discovery to the customized job development process, so informing what that customized job development strategy is going to be. AJCs have been part of the Lead Center initiative to expand the use of self-guided discovery. Lead Center has supported Griffin-Hammis to work in Arkansas, Georgia, and Rhode Island with AJCs. The AJC staff were trained to act as facilitators or guides for people who were using the self-guided discovery manual. So through a series of webinars that I expect will be archived on the Lead Center website soon, the AJC staff were trained on how to be an effective facilitator and a guide for people using self-guided discovery. And one of the things they did as part of their training is they actually went through and completed the manual on themselves to understand the process from a firsthand perspective. The nice thing about this model is that for an AJC case manager, helping act as a facilitator or guide for someone using self-guided discovery, it created a good focus for the case manager's meetings with that job seeker. They reviewed progress, they reviewed the process, and it kept things moving and focused in terms of arriving at that employment or career goal and then developing the next steps to achieve that. It really does put the control in the hands of the job seeker and encourages that responsibility for that process, but does not leave people to do that on their own. It does still, and the model still involves an AJC staff being connected with people, and in some ways being a second set of eyes around the discovery process and what's being learned to help the individual kind of pull out the most important things that they're learning from the self-guided discovery process that will then inform the employment search effort. While I don't have anyone on the line who's participated, I did get a quote from the Rapid Response Coordinator at the Georgia Department of Economic Development in the Workforce Division. He led the team in Georgia that was piloting, has been piloting the guided, this self-discovery process. And he said self-guided discovery was a great experience for the Georgia team. They collaborated on many different pathways in supporting people in that process. And due to the diverse professional backgrounds of the folks who came together in Georgia to pilot self-guided discovery, they felt they were able to suggest a lot of potential employment and career pathways that the individuals using self-guided discovery might not have otherwise considered. So again, some folks will say, I'm not sure where I'm going, I'm not sure what kind of work makes sense. Others may come in with very limited view about what is possible and what they can do, and discovery in either of those situations can help people really recognize the range of options that are available. Self-guided discovery, in terms of its benefits, just like any form of discovery, it is a great tool to create a really holistic picture of a person that then is used to inform the job or career goal and the job search in what ends up to be a much more sophisticated way to approach that. And in general, we've seen that this results in much more targeted and informed job search and ultimately a better job match. And that's one of the key goals of customized employment, is to do the work in a way that ensures the best job match, because that creates a win-win both for the employer and the job seeker. I want to move on now to talk about a company in my home state of Wisconsin that has taken customized employment to scale as a key HR strategy. And we know that customized employment is defined as a flexible process that is designed to create a personalized employment relationship between the job seeker and the business in a way that meets the needs of both. And one of the questions that's often asked is, how would a business actually use customized employment as a significant hiring strategy for that business? How would a business take customized employment to scale, and why would they do it? And so I'd like to feature this story just to give you an idea of, from a business's perspective, just how customized employment can benefit the business. Quick Trip is a Midwestern company, family-owned business that operates gas stations and convenience stores in Wisconsin, Minnesota, and Iowa. This year they celebrated their 50th year, and they now operate 475 stores across those 3 states. This is not a company struggling. This is a growing and prospering company. They are currently opening 35 new stores a year and adding 2,200 new employees each year. And at the moment, the company has over 14,000 employees and is consistently rated as one of the top places to work in these states. So in Wisconsin, it's the #1 employer. In Minnesota, I believe it's #3, and in Iowa, #5. So this is an employer that is highly regarded and viewed as a great place to work. The interesting thing is this is an employer that therefore has many people wanting to work for it. So they would never have a shortage of applicants for jobs. And so sometimes the question is, why would a company that really has no trouble attracting people to hire adopt a commitment to hiring people with disabilities? And Quick Trip just is very clear about that, and it is the business value that individuals with disabilities bring to their stores and to their team. And they learned this through their own experience of using customized employment nearly 20 years ago to employ a person with a disability in one of their stores. And the benefit at that point was recognized. The benefit was so great that they looked at, how do we take this notion of customizing a job around the needs of our store and the strengths of this individual with a disability? How do we actually capitalize on that in more than one store? And so the first customized employment job at Quick Trip, they would not use the term customized employment because, of course, it predates even the ODEP work. But this is essentially what they did. They have guest services coworkers. Those are the folks who staff their stores. They modified the job description of that coworker, guest services coworker, to match the first individual's skills and the actual specific needs that store had. So it was that match that we think about in customized employment. At that point, it was really what we typically would consider a job carve, where there was a pre-existing job description, and it was carved to match the person and the needs of the store. But that took root as their first example and led to them creating a mechanism to allow customized employment to grow in their company. They created a unique job title which permitted a flexible job description. So there was not a standardized job description attached to that title. There was the ability of each store to create a job description that met its needs and matched the skills of the person they were hiring. So you will not see the retail helper job description will not look the same in any given store. It truly is customized. And again, it balances the needs of the store and the strengths of the person working there. And that is, if you talk to the folks from QuickTrip, that is what makes it work. That is what makes it so valuable. So it's a win-win that balances the demand side and the supply side thinking rather than kind of pushing us into one box or the other. QuickTrip's scaling of customized employment, in my view, has been phenomenal. They currently employ 247 individuals with disabilities in the retail helper role, and they just passed a major milestone when they hired the 247th retail helper. They now have one in more than half of their 475 stores. The average pay for a retail helper is $10.19 an hour, and we are a state, and Wisconsin is a state anyway, that minimum wage matches the federal minimum wage. And the first retail helper just earned the month off with pay that comes after any employee at QuickTrip reaches 20 years of service. I want to talk more about the business case. Because this is clearly something QuickTrip did because it was a good business strategy. And these are some of the statistics that the HR department shared with me. The retail helper turnover rate is just 9.5% compared to almost 32% for other QuickTrip retail store employees. They also have tracked the performance of stores that have retail helpers, and they have seen that that consistently enhances and improves the customer's experience, increased coworker morale, and it frees up store managers and coworkers to focus on other areas of the store operation. So ultimately what they've found is stores that have retail helpers are consistently superior performers among all of the QuickTrip stores. So for them, the business case is obvious. They have invested in designing a way to have a customized positions, and the time they may put into designing that to the training of the individual, they see it as completely worth it over the long term. I do want to point out that retail helper positions are not the only jobs available to people with disabilities at QuickTrip. They are not pigeonholing people at all. They actively recruit people with disabilities at all levels of the company, and they have a very innovative return to work program that really assists any employee who acquires a disability to come back to QuickTrip and to continue their career with the company. But the thing about the retail helper position is through customization, they have offered positions for employment now to nearly 300 individuals who may not have been otherwise considered fully qualified for any of the QuickTrip positions that traditionally were available. So they do have efforts underway and ongoing efforts that anyone in a retail helper position can be promoted at any point, and they have a good track record with individuals being promoted from that position. Again, it's a family-owned company. They do a lot of internal promotion and career ladder opportunities. And again, a lot of people stay with QuickTrip for a long time because they are a good employer. And at the end of the day, QuickTrip is very sensitive to customer feedback. Everything they do as a company is about that customer experience. And they have said clearly customers value the retail helpers in the stores as much as coworkers and store leaders value them. So I think in terms of thinking about customized employment, we need to see that there are ways that customized employment can be taken to scale very effectively and create business advantage for a company. And we can support companies to develop those mechanisms that they need to have in place so that they can customize employment throughout their company. And in fact, when you look at, what is progressive HR strategy these days, customizing employment to the strongest strengths of the person, of your employee, is actually the best way to get the most out of that employee. And matching what people's strongest abilities are to what the company needs ends up being a recipe for success for any business. I'm going to turn it back to Rebecca now for the question and answer period.
No, thank you so much, Lisa, and thanks also to Michaela and Sharon and Margaret for talking about the successes that you've had with this process. We have gotten quite a few questions. I just wanted to make a few comments before we start responding to them. We've covered a lot of instances of braiding and leveraging resources, and some of the questions that came through asked about whether or not people can get job coaching or case management, service coordination services. And I think we've highlighted a number of examples where by the workforce system partnering with the long-term care system, the long-term supports and services system, or through a behavioral health agency, a developmental disabilities agency. As I mentioned in the beginning, Lead Center has done pilots that involved centers for independent living. Community colleges have been involved in some of the self-guided discovery projects. We are doing a project working in the homelessness system with people with disabilities. So there are numerous opportunities to leverage resources, especially for people who have complex needs and would benefit from support from more than one organization and from leveraging the resources across agencies. I wanted to mention, Lisa talked about the training for American Job Center staff for self-guided discovery. And in fact, in the 3 states that we worked in, there were teams of 8 people that were trained. So it was at least 2 American Job Center staff, 2 vocational rehabilitation staff, 2 community employment providers, and then 2 others who that team identified. So in some cases it was education, in some cases it was community college, independent living center. It could have been whoever the team wanted to work with. And you saw Lisa's quote from Georgia that they really saw the benefit of bringing together all of those different viewpoints, and they actually collaborated on implementing and pilot testing self-guided discovery with each team worked with at least 4 people in partnership, so that there were real benefits to that. One of the things that we didn't talk about is just how the guided group discovery and self-guided discovery processes worked. We do have facilitator training materials, and those are the materials that I mentioned in the beginning. The guided group discovery facilitator manual will be issued by LEAD in December, and it's a step-by-step process to train facilitators. In the guided group discovery states, we again trained people from multiple systems, including the workforce system, so that the guided group discovery sessions could be co-facilitated. And in most cases, it was broken into 5 separate sessions so that people would come together in small groups for an hour to an hour and a half to be building their job search profile and their discovery profile. And there were real benefits to having people doing it as a group because they were able to give each other feedback. They were able to really bring in additional suggestions. In many cases, people from someone's support network might have joined the session, but it was over a period of time. So Lisa mentioned people had homework. There were things that people needed to bring back and really reflect on what it is that they have to offer employers, what might their ideal conditions for employment be, and those kinds of things. So the facilitator's manual really provides a step-by-step process to train facilitators to run, to run those small group sessions. And similarly for the self-guided discovery, sometime following December, in a month or so after, we'll have a facilitator's training manual also to help people be able to support people who are more capable of really owning that whole discovery process themselves, or people perhaps who have a stronger support network who can do it with them. So these materials will be available and will be accessible through the website. There also were questions about whether or not this is being recorded, and next week there will be a link on the Lead Center website to the recording, to the PowerPoint presentation, and to a link to the transcript, so that since this is being live captioned, there'll be a transcript so you'd be able to refer back to it or share that with colleagues. So that responded to some of the questions that came through about starting your own guided group discovery session or your own self-guided discovery session. The materials will be available. It doesn't have to be done at an AJC, but there are real benefits to accessing the services that are available through the workforce system and through American Job Centers. As you saw from one of Lisa's success stories in Kansas, the workforce center paid for training. There are real benefits to leveraging those resources across systems. So if I can go to some of the questions that were asked. Some of the questions, and this may be for Brian, asks whether or not AJCs have counselors who receive specific training that enable them to work with members of the target populations, or is everyone expected to do that? So how are people prepared for being part of integrated resource teams and part of some of these processes? Brian, you may be on mute. Brian, are you there? Okay. So we're not, well, hopefully we'll get him reconnected to be able to.
Hello.
Oh, there you are. Okay, thank you.
Yeah, it said my mute was off, but it was on, so I clicked it again and came back. Sorry about that.
That's not a problem.
So the question was, have American Job Center staff been trained both around disability-specific issues and also around perhaps IRT facilitation specifically?
Right.
Is that a good statement of the question?
Sure.
The first way I would answer that is that American Job Centers are for all Americans, so they are not demographic specific. They deal with all targeted demographics, be that veterans, homeless, transitioning prisoners, people with disability. I guess I'm going to have to say that their level of comfort varies a lot from place to place. Some places are very comfortable, very up to the minute, very close to the partners that target job seekers with disabilities specifically, some less so. But the best way to get the center's attention is to come in and try to access services. That's always the best place to start. As far as the IRT, it's been implemented, again, in various American Job Centers throughout the country, often as a result of a DEI project or a Disability Program Navigator project. But again, this strategy is by no means universal, and that's part of the reason we're still trying to get the word out and trying to spread the idea, because the use of the IRT strategy really broadens the possibilities around serving customers with more challenges. So I guess that's how I would answer.
That's great. And there was a related question asking if people would need to have their own case manager to be able to make this work and to ensure that the process is benefiting the job seeker.
Well, generally speaking, if this is an IRT-specific question, it's very helpful to have one case manager who's willing to begin this process. If you move forward and you do get an integrated resource team built around you, usually what happens is you have multiple case managers all working towards the same end. So that's good, and different case managers might take the lead in different parts of the plan, depending on how relevant their resources and expertise was based on where you were at. That is definitely one of the things we're advocating for, though, is that the AJCs kind of adopt this model and take the lead in organizing IRTs for their customers.
No, thank you so much. The next question really is for any of you, and I think that Lisa, Sharon, and Michaela especially may want to weigh in on this. But the questions relate to issues of AJCs wanting to support or be part of customized employment processes. And the questions ask how one might interest a local AJC that really hasn't had an interest in supporting a customized process either through their direct services or through their business services functions. That what are the selling points and how might someone approach their AJC to be more open to partner with them on customized employment? Lisa, would you like to give that a shot? I think you're still muted. Okay, you should be on now.
Can you hear me now?
We can. Thank you.
Okay, I'm sorry. Yeah, I couldn't find the right window. Yeah, I mean, I'd be really interested to hear what Michaela or Sharon might also contribute from their perspectives as working in an AJC. But I think AJCs are generally looking for opportunities to connect with people who may not necessarily come through their doors and seek them out. And I think the models of partnership we tried to present are those that we believe, based on talking to a lot of AJCs, are very doable in regard to how AJCs function, how they're staffed, the other types of services and supports they typically offer to people. And this gives them an opportunity to partner in a way, I think, that will help build their knowledge and understanding of job seekers with disabilities and create a pathway to an employment outcome that it's just a really nice way to get to know job seekers with disabilities, to get to know the other support agencies and partners that are out there, and to see the possibilities for partnerships through the experience. So I do think, based on the good outcomes we've had in piloting, that approaching an AJC around using one of these models for discovery can be a great first step. And then their interest, I believe, in taking forward the outcomes of discovery and the plan and goals that people have, I think that will become natural, that they will see the obvious. And what Michaela coordinated in Kansas for Laura was a really good example, that out of discovery it became obvious that she could use some help to find an initial job, that they could provide some transportation assistance to enable her to keep getting to and from and maintaining that job, and then moving on to a certification that was actually going to help her reach her career goal. So I think it creates that opening for the relationships to develop and the partnerships to develop in a really natural way, and I think from that, the AJC will, just as someone said, I think it was Sharon, do what they do best.
Rebecca, am I unmuted? This is Chris.
Yes. Yes, you are.
Thanks. So I wanted to augment what Lisa just said, which was excellent, and that is that ODEP is in the process of collecting additional stories, both through the Lead Center. Gary Shaheen was on earlier. Gary has been collecting some stories for us and developing some other materials as well that are targeted specifically towards being helpful to AJCs and assisting them in understanding how this can be beneficial to them in providing an expanded range of potential options for their job seekers. We also have additional examples of employers in different industry sectors and how they have used some form of customized employment to be able to benefit their business. It's about the bottom line, and it's about superior performance, as Alicia shared with us when she was talking about Quick Trip. And we're going to be having all of those materials available and hopefully being able to work with ETA, the Employment and Training Administration, to get them disseminated to the AJCs across the country, and hopefully that will create additional interest. As we've discussed today, with Discovery kind of as the foundation, the first step in learning about where to go for finding the employment goal, there's not just one way, as we've learned today. We've heard several different models, and it does involve coordination of resources. I think that when we first started our customized grants back in 2001, there was a misunderstanding, really, that there was only one way to do it, that the AJC was expected to pay for everything, and I hope that one of the major takeaways today is the importance of the integrated resource team and coordination of resources across the relevant systems and programs for the particular job seeker, because when everyone's working together, you can find ways to provide to the individual what it is that they need to actually get the customized outcome. So we are actively working to get those materials finalized and hope to be able to have them out maybe even later this fall.
No, that's great, Chris. Thanks so much. Yeah, and I think, Lisa, also making the business case, the more information that's out there so that employers can see how other employers are benefiting from this, and by ODEP and LEAD and others putting those kinds of examples out there, it'll go a long way. I don't know if Michaela or Sharon wanted to add anything to that.
This is Sharon.
Yes, please.
Yeah, hi, this is Sharon. What I was going to say is, and Chris and Lisa, they said a bunch of great things, but I think, I don't know, from when I heard the question, I'm thinking more as they're a person who works at an AJC and wants to be able to implement it, and how would they get that across to their leadership team as it's a value for their job seekers. And I would just say to you that, first of all, really learn what some of these programs are, especially, for the customized and for the discovery. Tons of information on ODEP's website, tons of information on the LEAD Center, and it's basically another tool for our toolbox in the American Job Center, just like you would use on-the-job training or, some other type of service that we might have or program that we have. Again, it's just a tool for our toolbox, and it's one that's going to help people go to work.
No, that's great. Thank you so much, Sharon. And Michaela, did you have anything to add?
Yeah, I just would really echo most of what you and Sharon have said regarding the whole thing. My organization has always been really open to doing new things and trying new things, and part of what this has really helped with in regards to the new regulations with WIOA is getting us access to some of those people who are the hardest to serve, that have the most barriers, that don't often find their way into our centers for transportation barriers or other reasons that they're, that have already been talked about before, that they're just not making those connections with us. This has helped us reach out to them and go to them and be able to work with them in a more direct way than we probably would if they were just accessing services through the center on their own and trying to navigate those systems on their own.
No, that's great. That's really helpful. Thank you so much. We're at the end of our time. We put up a slide of just the different ways you can connect with the LEAD Center. We encourage you to do that. I wonder if Chris or Gary want to make any final comments?
Well, this is Chris again. Thanks again to Lead Center, to all of our wonderful presenters today. You guys are awesome. What you're doing is really helping to blaze kind of a new way of doing business for not just people with disabilities, but other people with barriers to employment. Because as we started out with early in the webinar today, this process can be so helpful to people who are trying to figure out where do I go for a job, where's the best fit. Where's the best fit for me? And it can really help people take themselves there, and it can help AJC staff to help them figure out how to get there as well. And so I thought it was really a great conversation today. So thank you to the Lead Center and all the presenters for their participation.
No, thank you, Chris. And Gary, did you have any final thoughts?
Well, just to echo what Chris said, I thought it was a wonderful presentation, and that the products that Chris mentioned, one other point on those is that when we developed them, they were developed with full appreciation of the types of formats and the types of delivery mechanisms that would be best used in AJCs and among DEIs. So we're looking forward to seeing those in final, and it was really a pleasure to work with ODUP on it. That's it.
No, thank you so much. Thank you, everyone, for attending. Thank you so much to the presenters today. We encourage you to go to the Lead Center site and check out our new customized employment section, which has the resources that the people who wrote the books on customized employment have recommended as their favorite resources. So it's a nice one-stop place to find resources. And this is the first of a series of customized employment webinars. So please join our mailing list if you're not on it so that you'll learn about the ones that are coming up. We will go through the questions that we didn't get to and post as many answers as we are able to. I know we didn't get to everyone's question, but we'll try and address that. Thank you, everyone. Bye now.